Hi, my name is Sam Marion, and I am a multiply neurodivergent licensed clinical social worker in private practice just outside of Atlanta, Georgia. I'm autistic, ADHD, I have a reading disability, have lots of executive function challenges, I have a facial tic. I check a lot of boxes in the neurodivergent umbrella, and I'm also a clinical social worker supporting a lot of families who experience neurodivergence within their home. So here's a few things that I think can help providers, but also parents, be more trauma informed. The first thing that I say to do is we need to support a person for who they are. Many people with IDD communicate in their own manner, and that's okay. Rather than try to get them to communicate the way I communicate, the way this person communicates, or the way that person communicates, let's work on communicating with a person and the way that they best communicate. We want to make sure that our environments, the spaces that people may come into, are trauma informed by giving a lot of options. Rather than try to get a person to fit in your space, what if your space can evolve or can adapt a little bit to fit more people? Can you adjust your lighting? Overhead lights may be really bright. Do you have any lamps? Can you adapt that sometimes based on the needs of the person coming in? Sounds. A lot of clinicians that I know have a white noise machines. Sometimes I need to turn those off. Do you have fidgets? Do you have maybe a weighted stuffed animal if someone needs that? Things that can help a person feel settled. Because at the end of the day, what we want to do is we want to help somebody settle their nervous system. We want to help your space feel as comfortable and familiar as possible for whoever's coming in. And that may include the family members of a child who's coming in, because as a parent can feel more settled, that creates space for the child to feel more settled. We want to partner with others in their lives, other professionals, other caregivers, maybe the schools. Little things like using consistent language. If I have a client that comes into my office and I find that the teacher that they've really connected with uses a certain language that the child has really connected with, well, I'm going to use that language. That seems to be working. I'm going to encourage the family to use that language. We want to meet the family where they are. We want to support them for who they are. When we can do that, we can give a family a different experience.